Very good morning. This is a message on behalf of the Secretary General of Indian Drug Manufacturing Association, Mr. Dara Patel, to public in general through Indo Analytics. Today are COVID times, and we all know that Indian pharma industry is very up to the challenges which are being faced across India and across the world. We are geared up to meet the requirements of the drugs which are very critical, like hydroxychloroquine or paracetamol and others, not just in India but across the globe. Today, Indian pharma industry can claim to be trailblazing the whole of world, supplying to many countries hydroxychloroquine and paracetamol and many other drugs. DGFT had initially instructed that Indian pharma industry should not export critical drugs like hydroxychloroquine or paracetamol, etc. But when Indian industry informed the government that they are ready with stocks for both India and the world, the government allowed us, and today we can be proudly saying that we are the largest by far exporter of many medicines. Keep in mind that today many of the Indian pharma companies are the largest generic companies in various parts of the world, including US, Europe, apart from South Asia, Southeast Asia, Africa and other countries. COVID-19 is a wake-up call, and we need to adopt short, medium and long-term strategy to make India self-sufficient in KSMs, intermediates and APIs. We need to keep in mind that till now most of our raw materials for antibiotics, vitamins, hormones, whether as APIs or intermediates or KSM, are sourced only from China due to the price difference from Indian manufacturers and Chinese manufacturers. This undermines our national health security, as also many other countries have realized that it is a definite health security for them too. Government therefore has proposed plans to boost the production of 53 APIs, which if properly implemented could go a long way in reviving the API industry in India, which was, let's say, a decade back very strong. The government but must consider clearing the bottlenecks for getting quicker environmental clearances. If the government is able to announce a package quickly for the existing as well as the new API industries which are bound to come up in the form of soft loans, capital subsidy, power subsidy, interest subsidy and other supports besides speedy environmental clearances, we from Indian Manufacturing Association can assure that there will be a vastly improved Indian API sector to become more self-reliant. India already exports pharmaceuticals to over 200 countries, as I mentioned before. India is the largest exporter of generic drugs globally and accounts for 10% of global pharmaceutical production by volume, but only 1.5% by value. The discrepancy highlights the relatively lower prices which the Indian pharma industry is supplying, and now COVID-19 has thrown open a number of other opportunities for Indian pharma sector as well as medical device sector. Apart from big players, SMEs and startups have equally good opportunities in expanding their business by collaborating in discovery of vaccines, developing medicines and cure for COVID-19, increasing the capacity of general medicines being manufactured, production of KSMs, intermediates and APIs. Also producing masks, gloves and PPI in large numbers. In the device industry, many companies are today producing equivalent to the international standards for ECGs and other equipment. Finances, banks, NBFCs, venture capitals will also have a huge opportunities to finance startups and SMEs in developing countries to develop new products like in India. All stakeholders, including the government, must come together to convert the current adversity into a massive opportunity. The Indian pharma industry has always risen to the challenges over the decades. This COVID-19 challenge shall pass, and we will ensure that all types of medicines are available in the market for our people and people all over the globe. As aptly reflected in India IDMA's theme, Indian APIs and formulations for global health care. Thank you. Wishing you safe, stay home and be healthy. India will fight back and IDMA will support through the drugs, through the APIs as well as through the medical devices. Thank you very much.